Every public school student across the state has attended at least a few days of school, whether it's in a classroom or maybe it's remote. And here to talk about it with us is Dr. Shira Doron, hospital epidemiologist at Tufts Medical Center. Good to see you.
Good to see you.
So what did you choose for your kids, and how is this week going for you guys?
Well, had it been an option, I would have chosen full in-person school for my kids because I think it's absolutely essential and that it can be accomplished with minimal risk, provided all precautions are taken, though there's never going to be a zero risk scenario. But my kids have been fully remote so far, and that's hard, but they're very much looking forward to being in a hybrid model starting next week.
All right, fingers crossed. Good. So let's talk about cases. This week, the U.S. hit 7 million confirmed cases. That is a huge increase from the start of the pandemic, when it took 3 months just to reach 1 million. What does this tell you about the strength of the virus in the U.S. right now?
Well, it's the nature of a virus that has what we call a reproduction number of 2 to 3, meaning every infected person infects on average 2 or 3 others, that the cases will grow exponentially, especially when people are not vigilant about things like masking and distancing. It also tells us that we're nowhere near that herd immunity, which is where there'll be enough people who are immune that the spread will start to slow. So we really have to keep following those precautions that we all know so well by now to protect ourselves and others.
Dr. Fauci said this week the U.S. is really still in the first wave of the virus because the cases never dropped low enough to establish a baseline. So what does that mean for this winter when we keep talking about this expectation that cases will increase?
You know, when you look at the country as a whole, it is true that that first wave of cases never subsided. But when you look at Massachusetts, it's a very different story. We had a massive surge of cases, and we've brought those numbers way down to very manageable numbers where hospitals have plenty of capacity to admit and treat patients. So if we have an increase in cases because of cold weather or a concurrent flu season, and we might, and we do expect, though, that it'll be a slower rise this time, but we're in a very good place right now to manage that. Plus, we have the advantage of months of preparation now.
Right, so in a better place here in Massachusetts than the rest of the country.
We are.
Yeah, reassuring on some level. All right, Dr. Doron, thank you so much for your time. Good luck with the hybrid next week.
Thank you, too.
All right, still